Welcome back to Girl Talk. We are here today at America's Best Flowers in Cottage Grove.
And Janet recently caught up with Dr. Angela Cotey at Village Smile Care. Let's take a look.
Nearly 50,000 cases of oral cancer will be diagnosed by the end of this year. So Girl Talk decided to head out to Mount Horeb to Village Smile Care and talk to Dr. Angela Cotey about this and learn a little bit more. Thanks for taking a few minutes with me today to talk about oral cancer. So 50,000 sounds like a lot. Is it a common cancer?
It is pretty common. You know, November is Oral Cancer Awareness Month, so it's a great month to be talking about this. And like you said, about 50,000 cases a year. Actually, one person dies every hour from oral cancer. So besides the prevalence of how common it is, it's really a very deadly cancer.
Mm-hmm. And so the prognosis is not good, but it can be detected and prevented, it sounds like.
It can. One of the big problems, so the survival rate is only about 50% after 5 years. So someone that's diagnosed today, only about has about a 50% chance of being alive in 5 years, which is really, really scary.
Yeah.
So one of the big problems is early detection doesn't happen very often. And so it's usually only discovered when it's pretty advanced or it's already spread, and then there's not as much that can be done.
Okay, so it sounds like it can go unnoticed for quite some time if it's only being discovered as a more advanced case. So how do you detect it?
So when you go to your dentist for a normal dental checkup, basically they're going to do a head and neck exam. They may kind of feel your lymph nodes and your tissue on the outside, checking for lumps and bumps. They'll check all your tissues inside for changes. So having regular checkups is really important. A lot of people don't visit the dentist every 6 months like recommended, or even for every couple years, so that's how it can go unnoticed. Also, sometimes it doesn't show up visually until it's a little more advanced as well. Luckily, there are some new early detection devices out there on the market that can be used. Our office has something called the Velscope here. So this device, it uses a blue light, and we are able to look through it, and basically it will show things before they're visual to the naked eye. So it fluoresces the tissue, and areas will look darker if there's changes underneath the tissue. So it's helpful to help us find something early. You know, I sent a photo and we can show that, you know, you can see that you can't see anything with the naked eye, but this case actually was cancer, and you can see the dark area under the Velscope.
Wow, what a great improvement over the visual screening. That's a lifesaver.
Yeah,
it sure can
really
be
is.
at least. Yeah. So what are the main risk factors in oral cancer?
Sure. So it is more common in men above the age of 40, and the two main risk factors, especially historically, have been use of alcohol or use of tobacco products, smokeless tobacco, chew, cigarettes and cigars.
Oh, wow. Okay, so if people avoid alcohol and tobacco, or quit maybe,
Yeah.
How does that affect their risk then? Does it lower it?
So it does lower the risk. However, there's a lot of new findings, and there have been a lot more diagnoses of young women in their 20s getting oral cancer, which is kind of alarming.
Is that from smoking?
Basically, it can be from smoking, but also there's a link now between the human papillomavirus and oral cancer, and so they're finding that there's a strain of it that can cause oral cancer. So younger people are getting it, people that have never smoked or drank at all. And so the CDC says about 80% of the U.S. population will have the human papillomavirus at some point in their life, but about 99% of the time it's asymptomatic, or they just feel a little under the weather, can be mistaken for a cold or things like that. So it is scary that, you know, basically anybody's at risk, so it's just really important to get those screenings.
Wow, like you said, and the regular visits, so there's some continuity, and you can have a benchmark to sort of look back at. All right, so sign and symptoms we should be looking for maybe on our own at home.
Yeah. So the main things are like a sore in your mouth that's not healing. Most things, you know, pizza burn, a cold sore will heal in a week or two. Any pain in the mouth, lumps, bumps, numbness, tingling, burning sensation. Those are all things to look for. But like we mentioned, really, it can be very asymptomatic. You cannot notice it. A lot of times it's under the tongue or the side of the tongue. So getting those checkups is important, and just kind of noticing and having awareness of your mouth and any changes.
Wow, and a really important topic.
Yeah.
Thank you. This is Dr. Angela Cotey. She's with Village Smile Care in Mount Horeb. We have more Girl Talk for you right after the break.